and welcome back to our webinar series. It's TED Talks, not TED Talks. We know we are the Colin Caterpillar of TED Talks. We are short talks, big ideas shared locally. We've reshaped our TED Talks for 2026, and we're now joined by our fabulous colleagues in Greater Manchester and Lancashire and South Cumbria. So we're a trio, we're like the three musketeers of the training hubs. But we'll still be recording all episodes. Everything will be able to be found on your Training Hub website. Cameras off, sit back, relax, and listen to what we've got on today. So I am Carla Romaitis. I'm the workforce lead and director of Joy. It's not my personality, it's more of a skill. I am moody most of the time, let me tell you. But I'm joined today by Louise Sproat, who is a HR manager at Southport and Formby PCN, and Vikki Brown, who is a practice manager at Cumberland House Surgery. They've been joining me on a leadership programme, a pilot for Joy at Work. This has been accompanied by the Joy at Work toolkit, which is accessible for all. You can find it on our website, and all of which was developed as a response to the retention surveys held across Cheshire and Merseyside over the last few years, where Joy was rated as most important to career. So welcome, Louise, welcome, Vikki. We're going to jump straight in. So Louise, you tell me, what appealed to you about the Joy at Work concept?
Fantastic. Any opportunity, things are challenging in primary care, aren't they? So any opportunity that you have, I think, to improve that joy, within your organisation is fantastic. And when you showed me the programme, Carla, it was the fact that it wasn't a tick box exercise. Don't like doing tick box exercises, don't do them. Everything's got to have a win and a goal for the end of it, and it's got to make positive changes, in the organisation that is carrying it out. I think what also attracted me to it was that you went there with rigid instructions on how to improve joy. You're there with the leadership team, myself and Matty Smith, who's been helping me with our Southport and Formby PCN doing it. You're giving us the theories and the reasons why we should do it, and then the ideas flow in those workshops that we've had so far and the ones that we're looking forward to in the future. So I just think it's infectious, the name of it, and we need to make sure that people give it a go and read the concept, and any opportunities to engage with our staff, find out what gives them joy and make any small changes that we can. If we can't do the big changes, small ones help as well.
That's absolutely spot on. It's almost as if you've been on a leadership programme. 10 out of 10, brilliant. So Vikki, you tell me, what have you found most useful in your real work situation after you've learnt these theories? What's been most useful?
Thanks, Carla. Hiya. So I found the most useful thing is that I've reconnected with my work colleagues who are on the ground, recognising that, we've got a business to attend to and patients to prioritise in the care, but ultimately, if we allow colleagues to know that there's joy connected with being in work and the recognition of their hard work, they will prioritise the tasks that need to be done, and in hand, then they'll feel joy completing those tasks.
Yeah. So it's kind of this cycle, isn't it? If
there's
joy within what they're doing, then they're more likely to do it well. Yeah. That's brilliant. So what changes have you seen in your workplace, in your practice since you started this programme?
So the biggest change for me was you introducing me to the contagion theory, which is it's contagious. If I'm joyful, if I am full of joy, not like jazz hands every day, but just maintaining a level of it's okay. We'll say hello, we'll smile. We will sometimes do jazz hands, but when we were all together, we had a training session together, and the level of joy experienced in-house after the training sessions there, when we had 7 members of staff attend, was incredible. The following day, staff members checked in with each other and extended this to colleagues who didn't attend, and it was a really uplifting situation where it was really lovely to see. I've adopted a secret joy ambassador as well to help me spread the joy.
Yeah, you've got a joy detective.
We're working together. It's just a lovely feeling to know that it's okay to come to work and enjoy being here.
And it was important, wasn't it, when we talked about joy, as you were saying, it would just be so bizarre if everyone was smiling. It'd just be odd, wouldn't it? You know, it's not, it's more than that, isn't it? It's about feeling safe, really, isn't it? And that could be calm. And that emotional contagion theory, it's so true, you know, and you do see it. It does catch when somebody is seeing something in a different way, a different perspective. You know, it does help you to kind of see it differently as well. So yeah, I love that. It's one of my favourites as well. So, Louise, tell me, how have you managed the change then? So, what you've learned, how have you managed that with the staff that you work with?
I think, well, we haven't finished yet, have we? Either we've only just started. We've only had workshop 1, and obviously going through the programme. We've got 7 departments here. At Southport GP Federation and the PCN, and approximately 70 team members. So the 7 departments and the team members. First of all, got our leadership, our management team on board, and those service leads. Again, the contagion theory. Did it with them first. To get them on board with any small changes that we can make. And now, by the end of next week, we will all have spoken to a handful of staff each, the 7 of us. And I've done it so that service leads aren't talking to their own team members. We've mixed it up a little bit so that there's potentially another positive of the fact that people are talking to staff members that they don't normally talk to, so initiate those conversations. And we want to find out we want them to rank those 7 drivers of joy, that we learned in workshop 1. What's important to them? We all rank them differently, don't we? And we did in the workshop, what's important to us and why we come to work and where we can find joy. So we're having one-to-one conversations with our team. It's been going on the last 2 weeks, and we've got a deadline of next weekend. And then after that, I'm hoping that we can look at those results. I'm hoping that I get a decent sized list of things that already bring them joy at work.
Yeah.
We already have well-being initiatives, healthy eating, exercise, lots of opportunities to come together as a team. But at the same time, we're not far from perfect. There's always room for improvement. I'm hoping that we can get a list of ideas of people of how we can make it even better and how we can improve that joy at work. And then depends on what comes out of those one-to-ones and those ideas and suggestions, then we'll start putting them into place.
That's it. And that is absolutely the ethos, isn't it, of joy at work. It's got to come from those people. It's got to be designed by the team. But we've spoke about this, doing that one-to-one and creating that time and that space to do it in such an intimate way is so key, rather than just sending out a survey. And I really love the way that you've gone about doing that. It makes them feel valued. I'm sure the fact that you've done that. Well, what advice would you give to somebody who wants to adopt the kind of theories and methods so far of joy at work? We've got nearly 30 people on the call. What advice would you give them if they wanted to start with this?
Check out, look at the programme on the website there, and just open it up, have a broad mind, if that makes any sense, of how you can take those theories, and make them adapt to your workplace. Biggest thing is you don't need a big budget. If you've got a budget, fantastic. You can, the bigger budget you have, the more you can do. But some changes don't need to have a cost associated with them, do they? We're all short of time. We know primary care is busy, but try and make the time where you can, to have those conversations with staff, and communication is a big one as well, making sure that you are asking them, listening to them, but don't be put off by thinking that it's a tick box exercise. It's rigid in what you have to do, because it's not, is it, Carla? It's how you take those theories and how you look at your own workplace, the people that are there, the culture that you already have within your organisation, and definitely just be open-minded and give it a go, as I'm really hoping that we have some positive results over the next 12 months, definitely.
I think that's perfect advice, and I'm going to leave just on the end with just sharing the actual what it looks like. So this is our Joy at Work toolkit. You'll be able to find that online. Hopefully you can see that, and then you can see the table of contents. There's loads of stuff in there. Remember the joyometer, so how are you even feeling? but this is all based around sound theory. You can find it in loads of different places. Harvard Business Review, we've got Amy Edmondson in there, loads of fangirl that I do around these theories. But this is the drivers of joy work that you were talking about, and this is what you've used as part of one of your methods of one-to-ones. So have a look. It's on our website. It's absolutely free. Love you to download it. I'm going to stop sharing now, and we've come to an end. We spoke for 10 minutes. It's gone super fast. Thank you very much. And just now over to any questions really for anybody else. So if you want to pop them in the chat,